Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order. So this is quite convenient for the study purpose. Thank you very much. I hope you will make use of it. In the last class, my dear friends, we are discussing about the holistic approach of Ayurveda. So what we are actually planning to state is it is a holistic development which is very important in children rather than the mere physical development. Now we have also explained a story of Prahalada where the fetal intervention has been done to inculcate holistic properties in a growing fetus, which was resulted in a successful outcome. Prahalada is born as a holy child and also the great devotee of Vishnu with the full of spiritual properties. Idea is to implement these principles in each and every pregnancy so that the born child will be full of holistic properties. So that is the first part we have covered. Today also we will cover the same thing but in a different way. The second part. Now, Ayurveda is a science which always has been recognized as a holistic science. Why it is called as holistic science? Because the total principles and also the what we say the theories, principles which is laid down in Ayurveda totally focus on developing the holistic property. Even in the treatment, it follows the holistic approach. That means mere treatment of the physical illness is not the treatment, rather than keeping the body and mind, atma, indriya, etc. in a balanced state itself is called as the healthy position. The same has been mentioned as swastasya swastharakshanam aturasya vikara prashamanam, which means to say that swastasya swastharakshanam, that is maintaining the health in the healthy person, is the primary motto, and treating the disorders in a diseased person is a secondary motto. So that means we have given more importance for health promotion rather than disease management. Now, if you look into the contemporary medical sciences, so they give more importance for the disease management. Hence, we can say it as a disease managers, whereas Ayurveda is a health promoter. Why I am telling this is, Ayurveda says that you have to treat the Purusha, whereas the contemporary medical science concentrate on treating the disease. Ayurveda never says treat the disease. It always says that first you treat the Purusha, that means the person. Okay, Atma, Mana, Indriya of that person. First you treat it. Then the physical body will be get corrected by itself. So therefore we have been told as health promoters with the holistic approach. Whereas the other sciences, medical sciences, were simple disease managers. Now what actually happened in the contemporary medical science is, so in the physics, as we say, we learn a lot about heat. Okay, we know that all the principles of a production of the heat and the measurement and calculation and all those things and its effects and all those things, but never learned the cold. What they assumed is absence of the heat itself is cold. They never made an effort to understand the cold also. They simply made a statement, or simply they thought that we have learned so much about the heat and absence of the heat itself is cold, which is not actually so. Similarly, absence of the light itself is darkness. They studied in detail about the light, but never thought of learning about the darkness. And what they assume is the absence of the light itself is darkness. But it is not like that. If you apply the same principle in the medical part, in the modern medicine actually they give more emphasis for the disease and very little on the health. So what they thought is just like absence of the lightness itself is dark, similarly what they thought is absence of the disease itself is health. But it is not so. Absence of the disease is not health incomplete. Okay, so lack of the health is the disease, but the lack of the disease is not the health always. This is the bitter truth. So what their principles say that you should treat the disease, and hence they are a very good disease managers. But what Ayurveda says is, along with the treating the disease, you have to also maintain the health, and they give more importance for the maintaining the health rather than treating the disease. Therefore, Ayurveda is a health promoter. Ayurveda is a health promoter. Because see, we find less references of Atma, Mana, Indriya, etc. in contemporary medicines. So what they say is a simple mere translation: Atma is equal to soul, Mana is equal to mind. So it is not so. If you learn Ayurveda in detail, you come to know that everything is Atma, Mana and Indriya. And as Mana says, as Atma rules, similarly the physical body goes off. Once this Atma goes out of the body, there is no role of the physical body. It is totally inert. That's a bitter truth again. Therefore, what we give more importance for the Atma, Mana and Indriya. That itself is the holistic approach. That make Ayurveda different from other sciences. That is the need of the hour also. We should not be the disease managers, rather we should be the health promoters. And these are some of the references which is available in Ayurveda for the topic what so far I explained. Dhatu Samya. So what is Dhatu Samya? Tasya Lakshanam Vikaropashamaha. We have to maintain the Dhatu Samya, homeostasis of the body. Homeostasis of the body cannot be maintained simply by keeping the physical things in right order. You should keep your mental faculty, psychological aspects, emotional aspects in order to have a Dhatu Samya, or homeostasis of the body, or homeostasis of the Purusha. Now, similarly, there is one more important concept related to the holistic approach is wellness clinic versus illness clinic. Now, suppose if you purchase an instrument, we know that along with that instrument, the company provides a brochure. That brochure gives the guidelines for the effective usage of that particular instrument. And now, suppose a newborn comes to this earth, okay? And but a newborn comes to the birth, nobody knows how to nurture the child. But it does not happen that, because we have the previous knowledge of our ancestors, that we know that how to nurture the newborn baby by breastfeeding and all those things. Okay. Therefore, nature will not give any brochure for the care of the newborn, how to handle this baby, because nature decides itself that. So humans, even including animals, they know how to nurture the baby, nourish the baby, take care of the baby, due to the older experiences. That means the previous generations, so they have got the experience of nurturing the newborn baby, okay, up to the maximum standard. Therefore, there is no need to give any brochure for that. Just for example, I told. What I mean to say is, previously we have got this knowledge. The previous generation, ancient generations, so they have got this common sense and knowledge of how to take care of the newborn baby. What I mean to say is, they know what are the parameters of the health. What is the parameters of health? They know that. They have very clear idea about that, and they know what should be followed to maintain the health, what should be the food which has to be taken to maintain the health, what are the food and regimen that has to be followed. All this knowledge was there in the previous generations. Unfortunately, what is happening is in the newer generation is they don't know this knowledge, and there is nobody to give this knowledge. The problem is because we have been into the nuclear families now, and the joint families are completely disappearing. There is no any senior person or senior citizen in the home who can give this common sense, knowledge of common sense, that what you mean by health and what you mean by illness. Nowadays, what happens, we are approaching the clinics or doctors for the normal problems. Many parents, they come to us with their kid just to clear their confusion whether my baby is normal or not. Actually, their baby is absolutely normal, but still they have confusion because nobody is there in their family to give this information. Yes, this is the symptoms of health. These are the presentations of health, normal health, and this is a presentation of ill health. Even that knowledge is also disappearing in the society. Therefore, they are now coming to each and every problem to the doctor only. Previously, this was not the case. Previously, only for the illness, people used to come to doctor. Nowadays, it is not like that. A patient of obesity, he will come to the doctor, what I should not take, what I should take. Okay, previously this system was not there. Previously, the older generation, knowledge gained by the older generation was transformed or transferred to the next generation, and they were giving the effective suggestions, and that was sufficient. But nowadays, we are seeking the help of doctors for each and every problem. That means nowadays there is no need of a more illness clinic. Nowadays there is a more need of wellness clinic, because we know that the patients are less and the normal persons are more, isn't it? So there is a need of illness clinic, less need of illness clinic, but there is more need of a wellness clinic. There is no more need of a wellness clinic. So why? That means now there is need of more health promotion, okay, rather than disease management. Disease management comes later. Now the need of the hour is health promoting clinics or wellness clinics, not the illness clinics. Why? Because there is a lack of inculcation of holistic properties in the generation, in the later generations. In the last two generations, we find this particular problem. So they don't have the health promotion techniques. They don't know how to promote their health. So therefore, they are seeking the knowledge, help of the doctors. Therefore, there is a need of wellness clinic, not the illness clinic. It comes later. So this is the second part we have covered in the holistic approach in pediatric care. In the next part onwards, again we will talk about some more things about the holistic approach. Thank you very much. So again, request to subscribe to my channel, and also please give your comments. Thank you very much.